Welcome to today's deep dive. We are jumping straight into a very specific and, honestly, a somewhat taboo question today.
Oh, yeah. It's a topic that catches a lot of people off guard, I think.
It really does. So, we're looking at why medical professionals universally enforce a strict 48-hour ban on sexual activity after receiving cosmetic fillers.
Right?
And that's whether those fillers are in the lips or, as the clinical guidelines very carefully phrase it, below the belt. The rule is absolute.
It is. And it's funny because patients often assume that once the bandage goes on, the procedure is just finished. They think, okay, I'm good to go.
Right, like the hard part is over.
Exactly. But this waiting period, it isn't about modesty or some sort of outdated prudishness. It actually comes down to pure molecular physics and fluid dynamics.
Which is wild. So to figure out exactly why this ban exists, for you guys listening, we've pulled together a really eclectic stack of sources today.
Yeah, we have a great mix.
We do. We've got the blunt, real-world clinical post-procedure guidelines for lip, vaginal, and penile dermal fillers. And we've paired those with highly technical research papers on gel rheology.
Right, which is basically the physics of how materials flow.
Exactly. And surprisingly, we also have research on 3D pharmaceutical bioprinting.
I know that connection between 3D printing a drug in a lab and injecting a dermal filler might sound like a massive stretch to anyone listening.
It sounds totally unrelated.
Right. But the physical forces at play are practically identical.
So our mission today for this deep dive is to fuse these different worlds to see exactly what mechanical stress and repetitive friction actually do to a cosmetic gel.
Yeah, we need to look at the mechanics.
Because we want to find out if skipping your doctor's orders for a little romance can actually ruin an expensive procedure by, causing physical asymmetry or extrusion.
And spoiler alert, it absolutely can. But to understand how friction destroys a fresh filler, you first have to look at how these gels are fundamentally engineered to move in the first place.
Okay, so take us into the lab.
So in the 3D pharmaceutical printing sources, there is a process called semi-solid extrusion, or SSE.
Right.
Basically, you are forcing a really thick viscoelastic paste through a microscopic nozzle to build a shape, layer by layer, on a print bed.
And a doctor pushing dermal filler through a tiny needle into, a tissue bed in your face or wherever, they're facing that exact same mechanical hurdle.
Exactly. The material in the syringe, which is usually cross-linked hyaluronic acid, or HA, it has to possess both viscous properties, meaning it flows like honey, and elastic properties, meaning it snaps back into shape like a rubber band.
Right, so it's this weird hybrid.
Yeah, it's a honey-rubber band hybrid. And the challenge is actually getting that hybrid out of the syringe.
Because it's thick.
It's incredibly thick. During injections or during extrusion in the 3D printer, the gel is subjected to immense shear stress. I mean, it is being forced from a relatively wide barrel into an incredibly narrow channel.
And if it stayed rigid, if it stayed like a rubber band, the amount of force you'd need to push it through would be, physically impossible for a doctor's thumb.
Totally impossible.
Yeah.
Or in the case of a 3D printer, it would simply shatter the printer nozzle from the pressure.
Wow. Okay, so the gel has to undergo a phenomenon called shear thinning.
Yes.
It basically shape shifts,
Yeah.
right? Under high pressure, the chemical bonds temporarily align, and the material acts almost entirely viscous, like a pure liquid, just for the split second it takes to survive the journey through the needle.
That's a perfect way to describe it. It's temporary.
I always think of ketchup in a glass bottle to make this make sense for me.
Oh, that's a good analogy.
Right, like you have to smack the bottom of the bottle with high shear force to get the ketchup to actually flow, but the moment it hits your plate, it instantly acts solid again so it doesn't just run everywhere and ruin your fries.
That is exactly what happens.
Right.
And in a 3D printer, if that extruded gel doesn't instantly solidify the moment it hits the build plate, if it doesn't act like the ketchup on the fries, your precisely printed pharmaceutical pill just collapses into a shapeless puddle.
It just melts.
Right. And in cosmetic dermatology, this immediate structural recovery is measured in radiology by something called the storage modulus, or G prime.
G prime. Okay, let's unpack that because you're going to use that term a lot. G prime is essentially the measure of elastic energy stored in the material, right? It's like the gel's internal memory of its own shape.
Yes, internal memory is a great way to put it. Once the gel is deposited into the tissue, it must instantly recover that G prime. It has to remember that it is a solid.
And if it doesn't?
If the hyaluronic acid chains don't immediately tangle back up and lock into place, the cheekbone filler or the Penile enhancement simply spreads out under the skin like spilled water.
Oh, man. So the gel survives this extreme, high-stress molecular magic trick just to get through the needle and recover its shape.
Yeah, it's a violent journey.
But when you look at the aftercare instructions across different regions of the body, you realize the survival test is really just beginning for this gel. The clinical guidelines we pulled are so incredibly strict about what happens next.
Yeah, the protocols reveal a very clear, undeniable vulnerability window.
Right. So for penile fillers, the clinical sources state a firm, non-negotiable minimum of 48 hours of no sexual activity whatsoever.
Nothing at all.
And that explicitly includes solo activity. And they highly recommend 14 full days before resuming full intercourse.
Which is a long time for a lot of patients.
Definitely. And for vaginal fillers, the mandates require 3 to 5 days of complete pelvic rest. And for lip fillers, it's 24 to 48 hours before kissing or even using a straw.
Yeah, the straw thing gets a lot of people.
It does. And up to 5 days before engaging in intense oral sex. So why so strict?
Well, the face and the pelvic regions are incredibly dynamic anatomical zones. They're constantly moving, and they subject that fresh, newly placed filler to two specific primary mechanical forces.
And these forces happen to perfectly match the mechanical stress tests researchers use in a rheology lab.
Exactly. It's like your body is a walking stress test machine.
Okay, so the first force is lateral shear. This is gliding or torsion friction directly across a surface.
Right.
Think of the rubbing motion of kissing or the friction of intercourse. And then the second force is compression and stretching.
Which is perpendicular pressure pressing straight down on the material or stretching the tissue around it.
Okay, but wait, I have to push back on this on a practical level for our listeners, because you are telling me a strict 48-hour ban is necessary just to prevent a simple kiss or gentle solo activity from ruining the procedure.
I am.
But this medical-grade gel literally just survived being forcefully extruded through a sharp metal needle. It seems so counterintuitive that it can't survive a little bit of surface friction.
I hear you. But you have to remember, it survived the needle because of its shear thinning properties. It shape-shifted to survive.
Okay.
But its state immediately after injection is incredibly fragile. When it leaves the needle and recovers its G prime, it is essentially just an isolated blob sitting inside a pocket of tissue. It has not yet woven itself into your biological matrix.
Oh, I see.
In the 3D printing world, it would be like touching a freshly printed object on the build plate before the polymer has actually cured.
Right. If you touch it, you smudge the whole print.
Exactly. It's just sitting there on top of the print bed, completely exposed to the elements.
Which brings us to the most critical question of this deep dive. Can repetitive friction from immediate sexual activity within this resting window actually cause asymmetry or mechanical extrusion? Like, will it ruin the shape?
The clinical and rheological sources say yes. Emphatically yes, and in some pretty dramatic ways.
Okay, break that down for us.
The mechanism behind this failure is fascinating. The first way friction ruins the result is through a concept called shear-induced diffusion.
Shear-induced diffusion. Right, because hyaluronic acid fillers aren't just a single solid mass, are they?
No, they are technically suspensions.
Right. You have microscopic particles of cross-linked HA suspended in a carrier fluid. And the research from Lehigh University on injection molding explains that when you apply repetitive friction, like the lateral shear of sexual activity, you create intense shear gradients across the gel.
Yeah, you are creating zones of really high friction right next to zones of low friction.
And then particles react to that.
They do. According to the mechanics of shear-induced diffusion, the physical particles in that suspension will actually migrate away from the moving boundary.
Wait, they move away from the friction?
Yes, they physically collide, push each other out of the way, and pool into the areas of lower shear.
Wow. So by rubbing the surface of the skin, you are literally forcing the microscopic building blocks of the filler to run away from the friction and bunch up somewhere else.
Exactly. And this is the exact physical mechanism that causes the sudden appearance of visible lumps, bumps, and permanent asymmetry.
That is terrifying.
You are physically sweeping the filler particles into an uneven pile underneath your skin.
Okay, so that's the surface friction. But beyond the surface, you also have to factor in the internal pressure of the body, because the clinical sources spend a significant amount of time warning about the Valsalva maneuver during this recovery window.
Yes, the Valsalva maneuver is a huge factor.
Right, and for those listening who don't know, The Valsalva maneuver is what happens when you bear down or strain. You hold your breath, your diaphragm pushes down on your abdominal cavity, and you drastically increase your internal pelvic floor pressure.
And this is a very common involuntary physiological response during sexual intercourse. You don't even realize you're doing it.
Right.
But that internal hydraulic pressure acts like a vice grip on the pelvic floor from the inside out.
And what does that do to the fresh filler?
Well, this internal compression can easily cause the fragile, tiny blood vessels around the fresh injection site to rupture, which results in severe, quote-unquote, burst bruising. Yeah. And even worse, that immense internal pressure simply forces the unanchored filler to migrate laterally. It just slides right out of the intended treatment zone before it has a chance to set.
It just squishes it right out of the way. But the most violent reaction we found in the sources, honestly, is mechanical extrusion or bolus formation.
Oh, this one is rough.
Yeah, this is where the biomechanics of your own body actively work against the procedure you just paid for.
Right. So ultrasound studies of filler injections reveal the intricate microscopic architecture of human tissue. When a doctor inserts a cannula, which is a blunt-tipped needle often used for deep filler placement, it has to navigate through the hypodermis.
Which is deep down.
Yes, and in doing so, it frequently distends and stretches the natural fibrous tissue septa under your skin.
Okay, let's explain septa really quick. These septa are essentially elastic fibrous bands that connect your dermis down to the deeper fascia, right? They are basically the internal scaffolding of your skin.
That's a perfect description. They're like tiny internal rubber bands. And when the cannula stretches those bands, their natural elastic recoil kicks in.
They want to snap back.
Exactly. The moment the doctor removes the needle, that fibrous tissue desperately wants to snap back to its original resting position.
Sure.
So it is already actively trying to push the fresh, unintegrated filler backward along the exact path the needle just created.
Okay, so let me get this straight. The internal tissue is already acting like a stretched rubber band trying to snap back.
Yes.
And if you add external sexual friction, and then you add the internal pelvic compression of the Valsalva maneuver on top of that existing internal recoil.
The gel is basically trapped in a vise. And like any fluid dynamics scenario, it finds the path of least resistance.
Oh, man.
The unintegrated filler reverts to acting more like a liquid under that combined stress. Your body and your actions work in tandem to mechanically extrude the filler right out of the precise pocket the doctor created.
So it just squishes backwards.
It either squishes backwards along the needle track into a concentrated, unintended ball, which we call a bolus, or the downward compression flattens it out completely into a useless microscopic sheet.
You are quite literally squishing your investment out of shape.
Exactly.
Which begs a very practical question for our listeners. Because if everyday movements, friction, and daily compression are this incredibly destructive to the material, how does anyone ever recover?
It's a miracle anyone heals.
Right.
Yeah.
What is actually happening on a molecular level that eventually makes this gel safe, allowing the doctor to finally lift the ban?
The reason patients can eventually resume normal life comes down to a concept we can call the rheological shield.
The rheological shield.
Yeah. The long-term stability of the filler relies on its complex modulus, which is known mathematically as G-star.
G-star. Okay, so G-star is the total sum of the gel's firmness and its ability to resist deformation. It's basically the big boss of the material's structural integrity.
You got it. And G-star is actually divided into two competing forces. We already talked about the elastic or storage modulus G prime, which is the energy stored and recovered.
The memory of the shape.
Exactly. But the counterpart to that is the viscous or loss modulus, which is G double prime, and that is the energy permanently lost to friction and heat.
Okay, so how do these protect the filler?
Well, fillers engineered for deep tissue projection, like those used in penile or jawline enhancements, they are built with a very high G prime. They are physically harder gels.
Right.
Once that 48-hour window passes and the gel settles, this high elasticity is what allows it to resist lateral shear stress.
So when the friction of kissing or intercourse happens, say, a week later, a high G prime filler simply absorbs that shear force, deforms slightly, and immediately bounces back into its design shape.
Right, much like high-density memory foam.
Okay, so the lateral friction is handled by G prime, the memory foam effect. But what about the vertical compression, the heavy weight pushing down or the thrusting?
That is handled by another critical property called cohesivity. And in rheology, cohesivity is measured by a mathematical ratio called the tan delta.
Tan delta. Let's break that down because it sounds intimidating. It is just the ratio of the viscous loss to the elastic storage. Essentially, it tells us if the material is going to act More like a liquid or more like a solid under stress?
Yes. And lower can delta means the gel is highly elastic and highly cohesive.
Okay, but what does cohesivity actually look like?
Think of cohesivity as the internal, microscopic adhesion between the different cross-linked domains of the hyaluronic acid. It is how tightly the gel wants to stick to itself.
Oh, I see.
High cohesivity allows the gel to resist vertical compression without spreading out into a flat sheet.
So if G prime is the memory foam bouncing back, cohesivity is how well the individual foam particles hold hands.
That's a great visual.
Right. Because if the weight pushing down on them is incredibly heavy, high cohesivity ensures those bonds don't break apart. They hold hands tightly.
Exactly. But here's the catch, and this is the entire reason the clinical waiting periods exist in the first place. That rheological shield is not fully active the second you leave the clinic.
Ah.
The filler needs time to integrate.
Because it takes anywhere from 2 to 14 days for the gel to physically and biologically integrate with your surrounding tissue matrix. Right.
Your body has to recognize this new material and actually weave its own natural collagen and elastin fibers around the gel to anchor it into the hypodermis.
It has to build the scaffolding around it.
Exactly. And until that biological scaffolding forms, the gel's internal G' and cohesivity simply aren't enough to fight off aggressive external friction on their own. The filler needs the surrounding tissue to hold it in place while the concrete sets.
It really is like pouring a wet concrete foundation. Like the chemical mixture has the potential to hold up a skyscraper eventually.
Right.
But if you drive a heavy truck over it 3 hours after you pour it, it's just going to splash everywhere.
It'll be completely ruined.
But once that critical 2 to 14-day window passes and the gel is tightly integrated into the dermal matrix, the G' and cohesivity can finally act as a durable shield. The surrounding tissue takes some of the mechanical load, and the filler safely absorbs and deflects the friction.
And that is why the strict 48-hour ban on sexual activity after receiving fillers is entirely about fluid dynamics. It's not arbitrary.
No, not at all.
Repetitive friction before the gel has integrated causes shear-induced diffusion, which forces particles to migrate into lumps. And then the combination of internal pelvic pressure and external movement causes mechanical extrusion, squishing the unanchored filler out of the target zone.
Right. So respecting the physics of your body during this vulnerable window is quite literally the only way to ensure the highly engineered rheological properties of the gel actually get the chance to do their job.
You have to let the tissue lock the gel down.
You do. But before we wrap up, we want to leave you with a final, slightly mind-expanding concept that blends these clinical guidelines and rheological physics with where the industry is actually heading.
Yeah, this part is really cool.
We established earlier that 3D printed pharmaceutical drugs use the exact same semi-solid extrusion physics to create complex structures on a print med, right? And medical researchers are already using this technology to print multi-layered pills.
They are.
So this raises a wild possibility for the future of cosmetic enhancement. Could we soon see programmable, handheld 3D bioprinters that print filler in situ, like directly inside the body?
It's a fascinating thought. Imagine a doctor moving away from just pushing a plunger on a blind syringe. Instead, they use a robotic, handheld micro-extruder that intricately weaves the gel directly into your unique tissue septa.
Layer by layer.
Exactly, layer by layer, acting like an interlocking scaffold from the very first second.
Because if a machine could map the hypodermis and print the filler so that it immediately interlocks with your tissue on a microscopic level, migration from friction could instantly become physically impossible.
You wouldn't even need a 48-hour waiting period or a 14-day integration window.
You could just get back to your life immediately.
Right, because the stability wouldn't rely on the slow biological healing of the body weaving collagen around a blob of gel.
Yeah.
It would be mechanically locked in place from the moment it's printed.
It's incredible to think about. So the next time you look at a medical syringe, remember, it isn't just a needle, it's a slightly imperfect extrusion nozzle trying to perform a high-stress molecular magic trick in a very messy biological world.
It really is.
You might walk out of the clinic feeling like the engineering is finished and the procedure is perfect, but until the physics lock into place, you are still navigating a highly vulnerable recovery window.
Give the material the time it needs to anchor itself.
Exactly. Respect the squish. Thanks for diving deep with us.